Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to FNHMA@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
Tansei, welcoming you to the FNHMA virtual town hall. I'm Marion Crow. I'm the Chief Executive Officer of the First Nations Health Managers Association, and we are broadcasting live from the NationTalk office in Toronto, home of the Mississaugas of the Credit, the Haudenosaunee, the Wendat people. We love being in this territory. What we love even more is you welcoming us into your nations, your organizations, and your territories all over beautiful Turtle Island. I want to tell you, I'm a Papa girl from Saskatchewan, but I do have the privilege of working, playing, and living in Algonquin territory in Ottawa. So some of our regulars will know that we've changed up the format a little bit. So we're so delighted to still be broadcasting live on the radio and on the live stream. That's Wednesdays at 1 o'clock Eastern, various times across the country. And if you want to check us out on TV, we're so excited to have APTN as a new partner, and we broadcast APTN 5 o'clock Eastern, but check your local listing for the APTN show on Saturdays. Shall we get to it, folks? I am so delighted to be welcoming in an all-ladies panel today. So we do have with us a returning guest, and I love Leila. Leila Gillis is joining us from Indigenous Services Canada. We have Dr. Shush as well, who's coming in to chat with us and share her knowledge. And I want to tell you, she was gifted the most beautiful, gorgeous skirt, and it is stunning. I wish you could see the bottom half of her, but don't worry, we'll get to her in a little bit as well. And then capping us out is going to be Marcy Auger from the Orange team, and I am delighted to hear some of the stories about what the vaccines have looked like in some of Northern Canada. So I think you know the drill by now. If you have a question for any of our guests, if you have an idea for a future guest as well, we are bringing COVID information to you via this format until June 30th. So send that question to fnhma@ihtoday.ca. Now, I know you're scurrying to your computer, you're typing that email now into your phones, and I look forward to unpacking some questions from you so that we can keep doing this two-way dialogue. So, shall we get to it? Let's get to it. The lovely Leila Gillis from Indigenous Services Canada is now joining to give us some epi-stats and information from our lovely partner, Indigenous Services Canada. Come on in, Leila girl.
Thanks so much, Marion. And thanks for inviting me back to share the COVID statistics with you all. And I think the last time I joined you was back in early March, and it's always such a pleasure to be part of IH Today and First Nation Health Managers Association's important work in sharing useful, reliable, and inspirational information. I'm joining you today from my home in Ottawa, Ontario, which is located on the beautiful, traditional, and unceded territory of the Algonquin Anishinaabe Nation. And I'd like to acknowledge the traditional stewards of the lands upon which all of those participating in the town hall today gather, with a special shout out to the East Coast of Canada, where I still call home, the traditional territory of many nations, including the Mi'kmaq, the Maliseet, the Inuit, and the Innu. And a special hello to Shehechit First Nation in Labrador, where I worked for many years. I'm Indigenous Services Canada's Acting Chief Nursing Officer and Director General of the Office of Primary Health Care. And my office is situated at the National Office of Indigenous Services Canada, where I work alongside the Chief Medical Officer of Public Health, Dr. Tom Wong, and the Deputy Medical Officer of Health, Dr. Evan Adams, who I believe joined you last week. I can tell you that it's a real privilege to work with such committed and dedicated colleagues. I'll start today with sharing with you some of the current COVID-19 statistics as updated this week on May 2nd. In this time period, the number of active cases reported in First Nations on reserve in Canada was 746. This includes 196 new cases. And this is compared to more than 83,500 active cases in Canada, with more than 7,500 of them new cases. Thankfully, the rate of newly reported COVID cases in First Nations continues to remain lower than the rest of the Canadian population. And we are monitoring this really closely on a daily basis and hoping that it will remain so. Since the beginning of the pandemic, the total number of reported cases in First Nation communities has been over 27,400, of which just under 23,400 are reported as recovered. This compares to nearly 1.24 million total cases in Canada, of which just over 1.135 million have recovered. We're also working across the country to track the COVID variants of concern on reserve, and there have now been over 670 reported cases in total identified in First Nation communities. Over the past year, there have been a total of 1,213 hospitalizations, of which only one is a new reported hospitalization this week of a First Nation individual who lives on reserve. This compares to over 65,000 hospitalizations overall in Canada. Unfortunately, there has been one new death associated with COVID this week, and an overall total of 318 deaths for First Nations on reserve across the country since the beginning of the pandemic. And the overall Canadian total deaths is now over 24,000. COVID is currently affecting 139 First Nation communities with active cases across Canada. And cumulatively, a total of 450 First Nation communities have been affected by COVID-19. On the vaccine front, over 99% of First Nation communities have access to vaccine clinics. And over 254,000 First Nation individuals living on reserve have received both their first and second dose of COVID vaccine. With the ramping up of the vaccine coverage in First Nation communities over the past 4 months, the COVID case counts in communities has dropped by 80%. This is really encouraging, but communities and individuals should remain vigilant and continue to follow public health measures as we continue to roll out the vaccine across the First Nation communities. And I'm happy to share that today, Health Canada offered some hope to parents anxious about their unvaccinated children by clearing the Pfizer product for use in people as young as 12 years old. After reviewing clinical trial data, regulators have determined that this Pfizer shot is safe to use in people 12 to 15 years of age, which is down from the previous cutoff of 16. This is indeed encouraging news. Pfizer is the first product to be authorized for use in this younger age category. Currently, the other products authorized for use in Canada, AstraZeneca, Johnson & Johnson, and Moderna, can only be used in people over the age of 18 for now. And before I leave you for this portion of the town hall, I want to acknowledge that it is Mental Health Week, and to recognize that these times of anxiety and isolation for so many people are a reality. The Canadian Mental Health Association reminds us to name it, not numb it, and to embrace all of your emotions, whether you're feeling good or challenging or difficult. It's all part of being human. And please do seek help if you're not feeling okay. I also wear red today in respect and recognition of missing and murdered Indigenous women, girls, and two-spirited people. It is the National Day of Awareness in Canada, also known as Red Dress Day. And I'd be remiss, as Indigenous Services Canada's Acting Chief Nursing Officer, to not give a great big shout out for National Nursing Week next week, May 10th to the 16th. Boy, what a year it's been for all nurses serving First Nation communities across this country. The theme of Nursing Week this year is #WeAnswerTheCall. And time again, nurses have gone the extra mile to answer the call in the fight against this pandemic, and to volunteer to take on additional roles in COVID testing, contact tracing, supporting families isolating at home, and supporting vaccine rollout across the country. It's been tough for nurses to balance their responsibilities at home while supporting all the extra responsibilities this pandemic has placed on their roles. They've adhered to personal protective equipment protocols every day, along with the many other public health measures, and in many cases, self-isolating from their family and friends to protect their clients and communities. Nurses have used their knowledge and expertise to pivot and respond as we learn more about COVID-19 throughout the past year, and also how it was impacting individuals and communities. I hope that you'll join me in expressing sincere gratitude to all the nurses working in First Nation communities over this past year, and who continue to come to work and demonstrate their commitment to well-being and health. I hope that nurses reflect as well personally on their self-care and remember to put their oxygen mask on first before helping others to place theirs on. It may sound a bit cliche, but I think I will wrap up with this sentiment to take away for everyone. If you save a life, you're a hero. If you save 100, you're a nurse. And maybe you can send a shout out to a special nurse you know on social media, or maybe even here today at the town hall. Thank you so much for the opportunity to share with you today. And now I'll turn it back to Marion.
Leila, thank you so much for those reminders. I really appreciate that. You can go ahead and mute now. I see you've just done that, but don't go away. You know we've got the inbox to come back to a little bit later. Leila, also, thank you so much for those heartfelt reminders about why we're wearing red today in honor of all of those who have lost a loved one. We heartfully missing and murdered women and girls and all the other diverse genders. Our thoughts and prayers are with you. And let's make sure that we're looking after our mental health as well. And another helpful reminder is it was National Physicians Day over the weekend as well. So what a lovely time to really recognize and honor all of the people who are saving lives, not just in this global pandemic, but everywhere. And to our health directors and our health managers who are watching us, I hope you feel the love and support that we send your way in keeping your nation safe from COVID-19. So, from a lovely nurse to a fabulous physician. Let's welcome for the first time, and I'm delighted that you were able to make the time to share wisdom and knowledge on the FNHMA Town Hall regarding COVID-19. Come on in, Dr. Suzanne Schusch. I almost blundered that, and we went over this before. Come on in, Dr. Schusch.
Hi, thank you so much for having me, Marianne. I'm so happy to be here today. So I'm Dr. Schusch. I am here in Toronto as well, originally from Alberta. My mother is Coast Salish from British Columbia, and my father is from Sudan. So I'm a First Nations and Black physician, mother, and advocate here in the city of Toronto. I was involved with Operation Remote Immunity from early February to March, and I'm also deeply involved in the vaccine rollout for First Nations, Inuit, and Métis people here in the city for our urban vaccine rollout, which is incredible. I think that one of the really important, reflections to think about today is the value of our community, and being Red Dress Day, being the Mental Health Awareness Week. I think that this is some time that we can really take to look at what are we doing to keep our community safe? What are we doing to protect our resilience, to protect our culture, to protect our languages, to protect our elders, to protect our children? So we're really looking at how do we protect ourselves for generations to come. This is not the first pandemic that we've lived through as First Nations, Inuit, and Métis people. This won't be the last pandemic that we live through. I know that the risks that we've faced in pandemic after pandemic in this country have been significant. We've seen, pandemics that almost, threatened the entire existence of our peoples in this country. And we've seen more recent pandemics, as recent as H1N1, where we saw 30% of people hospitalized in the first wave were First Nations, Inuit, and Métis. And we saw 20% of people that had died during that first wave were First Nations, Inuit, and Métis. And the very first person to die in Canada was a First Nations man. So we know that pandemics are going to disproportionately impact our community. We know that that is the result of centuries of policies and gaps in infrastructure, in funding, intentional exclusion from healthcare systems, from systems of wealth and political influence. It's really, we're starting to see the magnified results of marginalization. And I think that this is one of the first times that I've seen a truly strong attempt at an equitable rollout for a vaccine, for healthcare services, for First Nations, Inuit, and Métis people living on reserve. We know that people on reserves, I know it's incredible. We know that on reserves, the access to healthcare is truly there's a massive gap between what we can access on reserve and what we can access in the city. So for example, even in the city, we're looking at calling the experience that we're going through right now a healthcare system collapse, where we have to send people away from our cities, away from their homes, away from their hospital for care, where we're facing running out of oxygen, where we're facing issues of medical shortages of trained staff, shortages of nurses and physicians. And that, what we call a collapse of healthcare, has actually been the reality of life on our reserves for far too long. We know that there's been issues, all of the same issues that we're so scared of happening, they are happening across our province. And I think that was one of the reasons that it's so important to have the vaccine prioritized in Operation Remote Immunity, why that was such a phenomenal feat of logistics and cultural safety and community involvement. And it was really a model for reconciliation and care that we want to see going forward. So I'm really happy to be here today. We're still facing an uphill battle. We know still in Toronto, we've seen, again, the number one social determinant of health is truly privilege. It's truly having a house to socially distance in, the resources and the means not to work, political influence, economic power, not having to be an essential worker. We've seen, wave after wave, 80% of our people impacted by COVID have been BIPOC, Black, Indigenous, and people of color. We've seen the links between race, racism, poverty, and health. And we've really seen that First Nations people as well face a significant risk. They've been prioritized. Our community has been prioritized as First Nations, Inuit, and Métis people from the very beginning of the pandemic as a priority group for the vaccination, but we're still lagging behind in urban settings. So there was not that parallel rollout that Operation Remote Immunity was able to instill in the rural and remote communities here. It is being addressed as quickly as possible on a grassroots level, but we're still seeing rates, 3 times higher hospitalization rates with COVID, and significant higher morbidity and mortality at younger ages. So what we really want is everybody to be safe as possible. We want everybody to ask their questions, tell us what you're thinking, tell us how COVID is impacting you, what you believe and don't believe, what you think we could answer to make you feel safer. My goal is really to see as many of our people continue to thrive through this. And I know that there is so much more than just social distancing. It has been really hard for us. It's been a really hard year and a half, and we're going to get through it, but we've just got to keep working together to get there. So I'm very happy to be here today. Thank you very much.
Thank you so much, Suzanne. It was so empowering to hear you talk about the prioritization for the first time in vaccine campaigns and explain to us why it is so imperative that Indigenous people are prioritized and are having access to the vaccine. And I don't know if you want to share that beautiful ribbon skirt that you have on or not, but I'd love to show our viewers what that looks like. That is the most stunning ribbon skirt I have ever seen. So let's see it.
It's beautiful. So this was actually made by a local man in Toronto named EJ Kwandi-Benz, and it was made in honor of missing and murdered Indigenous women and girls. So I don't know if you can see it. I'm just trying to twist it around. And it has, I love this. I'm going to try and back up a little bit. And in honor of our community, of our women and our girls. Our women, our girls, our two-spirit, all of our people in our community that we really are sacred, we really have to protect, and we really are working towards. So this is a beautiful gift today that I'm so pleased and I'm so happy. I feel the ladies I'm working with today told me that my anti-transformation is complete.
Oh, it is just stunning, and I absolutely love it. So thank you for showing everybody the beauty of what's represented in that ribbon skirt. Thank you. Now, doesn't that feel good, everyone, to see everybody? I know that we are all struggling to maintain balance. We're coexisting in multiple family homes in some cases. We're unable to social distance, but here's a little hope. And I love seeing the surge and the research of people coming back to our traditions and preparing so that when we can gather safely again, we're going to be decked out in the beautiful beaded earrings, regalia for the powwow seasons, and all of those ribbon skirts that we just love to wear to lift up our women and girls. So that was a wonderful reminder of thriving resiliency, just like we've thrived forever. That is it in a skirt. Now, I do want to remind folks, if you have a question for any of our guests, feel free. If we don't get them on today, we come back to the inbox all the time. So that email address is fnhma@ihtoday.ca. So I look forward to getting those questions answered, and if not this time, next time. Okay, now for our third woman on this panel. of course, I'm not going to be able to speak today because I'm awestruck by the power of knowledge that these other women bring to our show. But we do have Marcy Auger with the Orange team to talk about some of those Operation North vaccine campaigns that have been going on. So, Marcy, are you ready to come on in? Come on into the Crow's Nest view and join all of our viewers and listeners on the FNHMA Town Hall. Marcy, over to you.
Hi, Marion. Thanks so much for having me today. So my name is Marcy Auger. I'm coming to you today from the unceded territory of the Algonquin Anishinaabe people in my home of Ottawa. A little bit about myself. I've been a paramedic for 25 years and the last 16 years out of the Ottawa area. I've been involved in disaster health emergency management and multidisciplinary teams for probably the last decade. That's been my focus, which led me to be the planning chief for Operation Remote Immunity. And I can tell you that that was a monumental privilege and really a highlight to be a part of that rollout. I'll tell you a little bit about Operation Remote Immunity and how it came about. So the ask was for to vaccinate the priority groups in our northern communities and to do that in 31 remote fly-in communities for all of the similar reasons that Dr. Schuch brought up today, and she was involved. We were very lucky to have her. You know, limited infrastructure, access to healthcare. So we had to do this within a certain defined time frame. We had from the beginning of February to the end of April. We were delivering the Moderna vaccine, which presented some challenges as well, which I can speak to. And there were a lot of conversations that went on before myself and my team were involved. But our job was really to take that objective, the ask, and to operationalize it and make it happen. So that's the context of the area that I was involved in. We had some principles that we had to abide by that were established by the NAN that we went through, and we came up with some strategies to ensure that we kind of followed all of those principles. The first was making sure we were in contact with the community leaders and that they were, we had some discussion and they agreed to accept and receive the vaccine in our teams in their community. So that was really important to have that discussion ahead of time. All of our vaccinators had to be double vaccinated. So there was a real push right at the beginning of this to get everybody and all of our team members vaccinated, both vaccines prior to going into community. And we added some additional things to that. We made sure everyone was COVID tested prior to going in community. And we did this in our hubs, in our staging areas. So we did this in advance of sending everyone into community because we wanted to make sure that we kept it as safe as possible. Everyone was required to complete cultural sensitivity training, which was critically important because while we had a lot of our team members who were familiar with working in these northern communities, we were bringing in so much help and so many different organizations. Not everybody was familiar. So we ensured that everybody had cultural sensitivity training. And then we set up hubs in Sioux Lookout, Thunder Bay, and Timmins. And I'll try not to get into all of those details because I could talk really I could take up your whole show and talking about Operation Remote Immunity, but I'll try to keep it short. Some of the logistics around, preparing for Operation Remote Immunity was, we had no shortage of people who were interested in participating and going out and contributing. But we had to ensure that everybody was clinically credentialed, that we had an appropriate rostering system to track everybody. And then we added some elements of training ourselves, specifically traveling in aircrafts, traveling in small aircrafts, being cognizant of the weather. I think our first week of ORI was minus 42, right? We have a lot of people who haven't been exposed to that kind of weather in those conditions. People volunteering had to be prepared to be available for an entire week at a time. So from Saturday to Saturday. So they traveled in on Saturday. The training and the cultural sensitivity training had to be done in advance. Travel on Saturday. Sunday was a full day of training to go over equipment, vaccine, supply, any other things that come up that need to be kind of gone over in advance. deploy into the communities from Monday to Friday, and then travel home on Saturday. So it was a long week. We tried to keep the timing to around 12 hours, but in a lot of cases it was 14 or 16 hours. And then related to that, while we had all these aircrafts moving our teams, we also wanted to make sure we had medevac aircrafts available in case something should occur. Understanding that, we didn't want to circumvent anything in the community. We followed the natural flow of things. If someone had an event, they went to the nursing station. There were very few of those. We were very fortunate, but we wanted to have all those contingency plans in place, recognizing where we're going is remote and isolated. So some of the strategies that we used to be successful, we did use the incident management system framework, which is a best practice emergency management framework. We followed a planning cycle. We had incident action plans. We wrote a plan every week. Even if it was very similar, we ensured that we wrote the plan every week. Everybody participated in the planning cycle, and then our teams were made up of a multidisciplinary so that we had some redundancy. One of the other things we did in advance was we did recce's, we were calling them, so reconnaissance or information gathering sessions. So we had a liaison officer whose role was to contact the communities in advance, contact the chiefs, the tribal council, the health authorities, whoever the community site coordinator was going to be for the vaccine rollout, and have any discussions in advance. And in a lot of cases, we actually sent a team member in advance to have a look at where the plan was to hold the vaccine clinic, and just make sure that we were doing everything as safe as possible, that we could maintain social distancing, reminding everybody that mask wearing was an absolute, making sure that we could maintain infection prevention and control mechanisms. That we had the facilities to accommodate everyone who wanted to come and receive a vaccine. Some of the other strategies, and I don't know if Dr. Shoes participated in that, but we did have on-site radio interviews in the community, or I think Dr. Shoes did participate in one of the radio interviews. So we wanted to make sure that we were open and transparent, and people could come. If they didn't want to have a vaccine that day, they could come and talk to somebody that day and come and discuss and have some conversation about it. And all of our team members were very open to that. So I think that was very encouraging for a lot of the community. And we did have the Canadian Rangers engaged also, who were very good at, going out, and because, some of the logistics, you go out to a community and it's cold and people don't have a vehicle and have to get to a vaccine clinic. That's where the Canadian Rangers come in. They really plugged a lot of holes for us that we needed in order to allow people to get to vaccine clinics. And then I think, just if I speak a little bit about the challenges and successes, am I still okay for time? So I guess I would say one of our biggest challenges was vaccine transport and storage. It's interesting that we were delivering the Moderna vaccine, and the requirements have changed since Operation Remote Immunity. Even there's, so many things we're learning as we move forward about each of these vaccines. But we had some very specific limitations, where Moderna, for example, could only be transported frozen. So we had we had in our staging areas, we had 2 freezers. One went to -80 to prime the cubes Moderna was transported in, and one went to -20 to hold the vaccine. And then the vaccine went in the cube in a special fashion. The temperature is monitored every hour, and we bring it into the community. Then it needs at least an hour to thaw. And once it's thawed, that vaccine can no longer be transported. It is thawed and it has to be delivered where it's at. So now we want to, make sure that we time everything well enough so we don't waste any vaccine either. So there was so many logistics related to transporting that vaccine, ensuring that we had enough thawed for whoever wanted to receive one, coordinate for people to come the following day if that was an option. And then we always had to think about weather contingency. There were a few weather days where we were not able to get into certain communities, and we really had to be mindful of that. So I would say the vaccine storage and logistics was probably one of the most complicating factors. And we had to come up with some really unique and unique ways to accommodate community members who were homebound, who couldn't necessarily come to the clinic. And we did find ways to do that. We had very flexible and adaptable team members. And we did use Orange paramedics specifically to be team leaders for each of these teams, because our paramedics, they're in and out of the communities very often in the north. They're very knowledgeable on aircraft and fixed wing environments and the temperature and the weather. They're familiar with all the equipment, the clinical equipment, the communications equipment. We had sat phones and Garmins, and there was so much built in to make sure that we could always communicate with our teams. So that was, some of those challenges we were able to mitigate in advance by ensuring that we had some Orange paramedics as team leads, and then our multidisciplinary teams, which consisted of physicians like Dr. Schuch, who also oversaw some med students that were with her at one point. We had paramedics from other services. We had nurses from FNHMA, from contract agencies. There were so many different agencies that stepped up to help us do this. It was absolutely phenomenal. And I guess I'll close by saying our successes were, I think 25,000 doses is what we administered in our 31 communities in Ontario. So that was fabulous. Providing people with the opportunity to go to these communities who haven't had opportunity before and to experience the openness and the warmth and giving people an understanding of what health equity means in these communities and how complicated that can be. And we had a lot of thanks and gratitude from the communities for coming and for providing vaccine, but the thanks and gratitude really went both ways. And we had team members who used words like this was life-changing for them, that this was a highlight of their career to be able to go into these communities and contribute in a positive and preventative fashion. And for myself specifically as a paramedic, a lot of times we're very reactive. Something happens and we show up and then we respond. This was an opportunity to interact with the communities in a completely different way, in a positive way. We're able to build some really strong relationships. And really, we are thankful and grateful, and we feel privileged to have been invited into the communities to participate in something so monumental.
Monumental is right. Thank you so much for sharing that journey. I mean, a lot of people know that it's challenging to get resources, food, and the cost to get things to the north, and to actually be able to make the north a priority is stunning and spectacular. And I thank all of the paramedics as well. And speaking of thank yous, let's give a second to cue the public service announcement from the First Nation Health Managers Association and partners. And let's join in celebrating and thanking everyone who is keeping our nation safe. So to the studio, we're ready for that video now.
To all the dedicated healthcare workers and providers on our community front lines, we thank you and owe you a debt of gratitude. We stand united as Indigenous health organizations. We support you all in your efforts. For credible information sources on COVID-19, please visit the Public Health Agency of Canada and Indigenous Services Canada websites. The partner organizations mentioned here are also trusted sources to support you. Thank you, and stay safe.
Love and gratitude. I hope you are just wrapped in love and warmth and all of those thank yous that we send to you. And I hope the panel feels love and gratitude from the First Nations Health Managers Association. We thank you as well, Leila, Suzanne, and Marcy. Thank you so kindly. speaking of thank yous, I do want to give a quick shout out to Pascal Belanger, who is interpreting so that our Francophone populations can also get this message as well. It's a wonderful and privileged place to be in, to broadcast in different languages, to reach a bigger audience. And speaking of audience, oh my God, where's my magic mirror from Romper Room? Remember last week, all of our listeners, viewers? So it's time to bring out the Romper Room mirror and give shout outs to Leland, RC, Stella, Donna, Kathy, John. I do see Amber, Jen, and Darlene. I see you too. So thank you for choosing the FNHMA COVID-19 town halls as your trusted, reliable source for information. So I'm very delighted now to be able to look into the inbox, and I'm just gonna get folks ready. So I will call upon you individually for questions from the inbox. So Marcy, since you ended our dialogue, why don't we go to the question for you right away? And bear with me, folks, I'm using a new technology platform. So I am just going to pull up that question for Orange. So Marcy, I have a question. You talked about some of the challenges your team ran into regarding Operation Remote Immunity. Were there any suggestions or changes you would make regarding reaching remote communities going forward? So I guess we're looking for lessons learned. And then another question, Marcy, is who were the major collaboration partners? I know you talked about Dr. Shush, and you've talked a little bit about NAN as well, the Tribal Council. Were there other Indigenous organizations? Do you know if anything like this has been done before? And what were some of your highlights other than all that love and gratitude you got? So over to you, Marcy.
All right, that's several questions. I'll try to answer what I can. So there were several agencies involved in the initial discussions for rolling out the vaccine. There was the Remote First Nations Community Vaccination Distribution Group and federal partners, Indigenous Health Services, and then all of the several tribal councils. There was I don't know that I can remember all of the different organizations involved. Really, at my level, the operational level, was where we engaged the clinicians and the operational staff. We had Dr. Schuss did come on 2 occasions, and in one she came as University of Toronto with med students, and we did have several med schools who signed on to assist us. So U of T, Queen's, the Northern Ontario School of Medicine. We had the, as I said, FNHMA and Indigenous Services. We had local emergency services, so paramedic services in Kenora, North Superior EMS, and then in Moosonee and Saskatchewan area also we had James Bay ambulance service in Waha who assisted in that area. We did have a large number of Calian nurses who also participated. The list goes on, and I'm really worried that I'm going to miss certain people. I don't have that list in front of me, but there was no shortage of people who were interested in participating and assisting us. Sorry, can you tell me again what the other questions were? Now I get excited and I forget.
Would you do it again?
Oh, absolutely. I mean, this, like you said, this was such a remarkable opportunity to be involved in something proactive, something preventative, something that, you know, if it could be catastrophic, really, in these communities, while we work towards better health equity, this could be catastrophic in these communities, and this really gives us the opportunity to mitigate that catastrophe in advance and do it in a positive light, and do it you know, with everyone who has the opportunity to discuss and learn about this together. We did have other challenges and things that are, might seem like a little thing, but for our paramedics is sometimes a normal thing. So we're very accustomed to working in out-of-hospital environments, right? Our office becomes anywhere we show up. That's where we work. We had in some cases power outages in the vaccine clinic while we put on a headlight and continued administering vaccine. It didn't stop us from doing it, but that was part of having that multidisciplinary team who was very adaptable and flexible and able to problem solve and troubleshoot on the spot and make sure that the operation didn't stop, but the operation continued to go forward. I think the transportation and storage, I come back to that because that was really a limiting factor for us, and it really challenged our ability to mass vaccinate, I guess, because we had to keep things within a very specific timeline. Once the vial is punctured, it's only good for 6 hours. Out of the fridge, it's only good for 12 hours. So there were so many limitations. And now that we're learning more about the vaccine and their stability of those vaccines, we have a little bit more leeway. So I think the planning and having we were very fortunate. Our CEO, Dr. Homer Tien, is very passionate about health equity and very passionate about being inclusive in remote communities. And he was very firm on ensuring that we had a stable vaccine supply so that we could meet the ask. The ask was vaccinate everyone who wanted a vaccine from this date to this date. 28 days apart, and the only way we could do that was with a sure vaccine supply, which is one of the challenges that we're seeing everywhere now. So I think when we're working in these environments and we have a defined timeline and defined objectives, having the tools to do the job is really critical, and vaccine was really a critical factor for us. I hope I answered your questions. Did I answer them?
You did. Thank you so much, Marcy. And Dr. Shush, come back on in. I do have a question for you as well. You know what? As an Indigenous physician, to be included in the mission Operation Remote Immunity, how important to you was that activity? Did you feel embraced in the nations? Were people lined up to get vaccines? Tell us a little bit about being an Indigenous physician in this project.
I think that that's one of the best experiences to have is when you can work in the community that you're from. And I have so many of my patients that will talk to me and just be like, oh, it's so amazing to have an Indigenous doctor. It's so amazing to have somebody from my community, somebody who knows me, somebody who understands our history. And it's the same for me as well. It's like coming home. It's like being at peace. It's just being with your people, with your northern relatives. It was truly one of the best experiences. On my mother's side, I'm an intergenerational residential school survivor. My family also grew up in Indian hospitals, getting their care from Indian hospitals, having experiences of just the same exclusion, the same marginalization, the same disempowerment, and really understanding the impact that has on people trusting our care, on people trusting us coming into their community and not harming them, and people wanting to see us, wanting to feel that I would not, inflict further trauma. Just as a personal, I would do everything possible to make somebody feel comfortable and to make somebody feel that this experience was something positive, that there was nothing traumatic or triggering that reminds them about painful experiences. And I think that even understanding the issues of vaccine hesitancy that people call is truly a reflection of your interaction with the healthcare system. If you've had good experiences with the healthcare system that's never let you down, with the healthcare system that's designed for you, designed by you, you will have a lot higher trust in it. And I think that just feeling like I could bring a level of trust to community was really incredible. Feeling that when, I could relate to somebody, being a residential school survivor or an intergenerational residential school survivor, you can relate to stories about horrific experiences that have happened. And I think that that really was one of the most incredible things. And I know that that was a priority for Orange. Every single team on in community had Indigenous providers on it, whether they were physicians or nurses or logistics. Every single team member, and as much as possible, team members were included that were from the community as well. We did see people lining up the doors, and that is a testament to the work done on the ground by the communities themselves. You know, the issues of vaccine hesitancy were there, but it was the same fear that everybody has. The fear of the unknown, the fear of being the first, and that was unusual for our community. That's not normal. But the people on the ground from the community, the healthcare workers on the ground, the community leaders, the elders, the band council, the chiefs, they were incredible. And they poured their hearts into making the community prepared. And when we arrived, the communities were prepared. And it was really fun. It was just like going to a powwow, you know, and being on the radio, being on the Black radio. You know, they would suddenly flip out their phone and do an Instagram Live or a Facebook Live on the spot just to say, you know, oh, spot's opened, or this, you know, let's chat with this person, chat with that person. It was really, it felt like a family event. And I think that that was something that we're really trying to emulate here at our own vaccine events here, is making it a beautiful, comfortable, familiar space of familiar faces, of a place of safety and a place of warmth and a place where you feel good about having come and good about having had a vaccination.
Thank you so much, Dr. Shush. You know, speaking of vaccines, there are questions in the inbox. A lovely Leila, I'm tagging you to come back in. So we've had a lot of discussions this week specifically about vaccinations, and I'm not going to get into the debate about what's happening in the media right now, but here's a firsthand question from one of our viewers, and they're saying, I'm a 45-year-old woman. I received my first shot of the AstraZeneca vaccine 6 weeks ago. Can I still get sick and end up in the ICU? And we are hearing of breakthrough infections after some people have had the immunization. Which vaccine should I get for my second dose, and when? Is it a good idea to switch up the vaccines, if that's even an option? And I know we're saying get the vaccine that's offered to you just because we need everyone vaccinated right now. So I'm going to ask Leila to comment on that. And Dr. Shush, please feel free to jump in on that question as well.
Absolutely. And you know, congratulations to the individual who got her first dose. That's really awesome and encouraging. And you know, and that's why there are two doses. You know, the effectiveness of the vaccine after the second dose is a boost, but you do have a considerable amount of protection from that first dose. But you know, it's why I kind of stressed earlier the importance of continuing with public health measures after you get your vaccine, and you know, because there are some possibilities of getting breakthrough infection. Your chances of becoming seriously ill are going to be reduced because you're smart and got your vaccine. And with that second dose, it's going to be even a stronger sort of immune response against hospitalization and severe illness. So your chances of severe illness has been reduced because you've had your first dose. The second dose timing is a little dependent on where you're from. So I do suggest you seek advice from where you actually received your vaccine in regards to the timing for your second dose. Typically, your second dose should be the same as the first dose that you received. For example, if you received AstraZeneca, your second dose would be AstraZeneca. If it was one of the mRNA vaccines, Pfizer, the second Pfizer, Moderna, etc. So right now, I know there are clinical trials and others looking at the effectiveness of combination of vaccines. I don't know. I could be corrected, but I am not familiar right now that that's the practice. So I would consult with where you received your vaccine and seek their advice in regards to the timing and, of course, what they advise you to receive for your second dose. And congratulations on getting your vaccine. I'm still on a waiting list.
Oh, Leila, I'm so happy that you've got yourself on a waiting list. We need to learn or lead by example. So thank you for getting yourself on a waiting list. I have had the privilege of making an informed decision, and that's part of the dialogue here of giving you the information so you can make that choice. And I am so happy to have been vaccinated with my first dose and get my second dose on June 4th at Wabano. And here I go again, hashtag be great, vaccinate, borrowed from Wabano Health Center in unceded and unsurrendered Algonquin territory. Dr. Schuss, was there a final comment you wanted to share with our listeners before we start wrapping up? You've got about a minute.
No, I would just say that be sure to speak to people that you feel have reliable information. There's a lot of misinformation, a lot of confusing information, a lot of scary stories, a lot of myths around vaccination, and a lot of fear. And that fear is legitimate. That fear is okay to have. If you're choosing not to get vaccinated, make sure you're still washing your hands, doing your distancing, wearing your mask, and protecting the people around you. And remember that every single person that is vaccinated, they're not doing it just for themselves. We're doing it for our own community as well. Everybody that we come in touch with, and everybody that the people that we come in touch with. So the more people that agree to do this, we're so thankful. We're so grateful. Everybody that takes a vaccine, thank you. And really don't be shy to speak to your healthcare provider if you have any concerns. And if you're in Toronto, you can come down to the Doje Minunisiwinang Vaccination Clinic. And then, of course, Anishinaabe Health is running their vaccine clinics as well. And we will be very happy to see you there.
Oh, thank you so much for the reminder. I know that Toronto is a hotspot. We're seeing patients being transported to other areas of the province. So let's all do our part in keeping everybody safe during such an unusual time. Now, I do have a couple of thank yous I do want to get to before this hour wraps. And can you believe how fast this goes by? I'm just baffled by how quickly it goes. And just a reminder, I know there were some questions we didn't get to, but you can still send a question for next week if you so choose. That is FNHMA at ihtoday.ca. And with that, I want to say a huge thank you to our live Facebook streamers, and that is Mi'kmaq Maliseet Native News in Nova Scotia, the Wolf 95.7 Nation News, FNHMA, of course, Element FM in Toronto and Ottawa. It was great to talk with you yesterday as well. Anishinaabe Nation also airs us, and Wawate News in the Sioux, Element FM, and CIFM in Winnipeg, APTN News. Thanks for joining us and sharing us on your channel. NBC Radio in La Ronge, Eagle Feather News as well. We thank you. We also have Alberta Native News, CJWE, CFWE, CKLB, Co-op Radio, First Nation Drum, CFNR in Terrence. And we thank you so much. Until next time, stay safe. Hi.